Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, look at back pain from a different doorway. Do not begin with the spine only. Begin with the gut. Ask yourself, why would bacteria in the intestine have anything to do with pain in the lower back? How could a capsule, yogurt, or carefully selected probiotic strain-influenced tissues as deep as the intervertebral disc? At first, that connection feels almost hidden. We are used to thinking about back pain as a mechanical story. Poor posture, heavy lifting, weak core muscles, disc bulge, arthritis, or long hours of sitting. Yes, respect all of that, but now add another layer: inflammation, immune signaling, metabolic byproducts, and the gut disc axis. Back pain is not always simply something is out of place. In many people, especially those with chronic low back pain, the pain system becomes a conversation between the spine, immune system, nervous system, and metabolism. The European Spine Journal review on the gut disc axis explains that microbiome imbalance may influence intervertebral disc degeneration and low back pain through bacterial movement across a weakened gut barrier, immune system regulation, and gut-derived metabolites that may reach or affect spinal tissues. So listen carefully. Probiotics should not be presented as a miracle cure. Do not say, "Take probiotics and your back pain disappears." Say something more medically honest and more useful. Probiotics may help certain back pain patterns by calming low-grade inflammation, supporting the gut barrier, influencing immune signals, and modifying pain-related biochemical pathways. Why does that matter? Because chronic back pain often survives even after rest, stretching, massage, or pain tablets. Why? Because the driver may not be only mechanical, it may also be biochemical. If inflammation keeps whispering to the nervous system every day, the back can remain sensitive long after the original strain has healed. So, today, do this. Widen the lens. Keep the spine in view, but bring the gut into the same picture. First, understand the target. The lower back contains intervertebral discs, vertebral end plates, nerves, ligaments, muscles, and small joints. When discs degenerate, when end plates become inflamed, or when nerves are sensitized, pain can become persistent. One specific MRI finding, called a modic type 1 change, reflects inflammatory change near the vertebral end plate and is often associated with more intense chronic low back pain. Clinicaltrials.gov describes modic changes as inflammatory end plate changes, mainly in the lower lumbar spine, and notes that type 1 changes are associated with more intense pain and worse outcomes than some other degenerative findings. Now ask, how could probiotics influence that? Start with the gut barrier. Think of the intestinal lining as a selective border. It should allow nutrients through while keeping microbial fragments and inflammatory triggers under control. When the gut barrier becomes more permeable, bacterial products such as lipopolysaccharide can enter circulation more easily. The body may respond with low-grade immune activation. That immune activation can raise inflammatory mediators, including cytokines such as TNF-alpha, Illinois-6, and IL-1-beta, which are also discussed in relation to disc degeneration and low back pain. So here is the first command: protect the barrier. Why? Because a calmer gut barrier may mean fewer inflammatory alarms reaching the bloodstream. How? Through dietary fiber, fermented foods when tolerated, adequate protein, sleep regularity, and, in selected cases, probiotic strains with evidence for immune and barrier effects. A 2023 systematic review and meta-analysis in Frontiers in Immunology reported that probiotics can support intestinal barrier function and also evaluated inflammatory outcomes, including C-reactive protein. This does not prove that every probiotic fixes back pain, but it supports the biological pathway. If gut barrier function and inflammation can be influenced, then a gut-directed strategy can plausibly affect pain conditions in which inflammation plays a role. Second, focus on immune modulation. Why do some people have back pain that feels deep, aching, stiff in the morning, and resistant to ordinary rest? Sometimes the immune system is involved, not necessarily as a dramatic autoimmune disease, but as a low-grade inflammatory state. Probiotics can interact with immune cells in the gut-associated lymphoid tissue. They may help shift immune signaling away from excessive inflammatory activation and toward more regulated responses. A medical review discussing dysbiotic gut and low back pain notes that probiotic administration may shift the inflammatory balance away from pro-inflammatory cytokines and toward anti-inflammatory mediators such as IL-10, FOXP3, and TGF-beta. Say that slowly. The goal is not to numb the back. The goal is to lower the background noise that keeps pain circuits irritated. Now ask, how does pain become louder? Pain is not only a signal from tissue damage, it is also processed by nerves, spinal cord pathways, and the brain. Inflammation can sensitize these pathways. When cytokines and microbial metabolites disturb the system, the same movement, the same chair, or the same morning stiffness can feel worse. So do not only ask, what movement hurts? Ask also, what is feeding the sensitivity? Third, consider the gut disc axis. The European Spine Journal Review describes 3 possible mechanisms by which gut microbiota may contribute to intervertebral disc degeneration and low back pain: bacterial translocation, systemic immune regulation, and metabolite production or absorption. This is where the topic becomes especially important. The disc was once treated almost like an isolated structure far away from the gut, but newer microbiome work challenges that simple separation. Some studies have detected microbial signatures in disc tissue and discussed overlap between gut-associated microbes and spinal disc environments. So ask the room, what if some chronic back pain is partly a distant echo of gut inflammation? What if the spine is not acting alone? Do not overstate it. Keep the science disciplined. This field is still developing and many studies are small or observational, but do not ignore the signal either. A 2020 Frontiers in Endocrinology study in overweight and obese adults found that altered gut microbiota composition was associated with back pain, supporting the idea that microbiome patterns may be linked to pain through immune and metabolic pathways. More recently, a 2025 metagenomic case control study of modic changes reported gut microbiome dysbiosis in people with those inflammatory spinal end plate changes, suggesting involvement of a gut-bone pathway. Now translate that into action. If you are discussing probiotics for back pain, tell people this: choose specificity over hype. A probiotic is not one thing. Lactobacillus rhamnosus GG is not the same as Bifidobacterium longum. A multi-strain blend is not the same as fermented cabbage. Dose, strain, duration, and patient selection matter. The most direct clinical trial for this topic tested Lactobacillus rhamnosus GG in people with chronic low back pain and type 1 or mixed modic changes. 89 patients were randomized to receive either 6 billion colony-forming units twice daily or placebo for 100 days, with 1-year follow-up. The predefined disability and combined back plus leg pain outcomes did not show statistically significant differences, but back pain alone decreased by an average of 1.1 points more on a 0 to 10 scale in the probiotic group at 1 year, with no increase in gastrointestinal side effects compared with placebo. What should we learn from that? Do not exaggerate. The trial does not prove probiotics are a powerful standalone treatment for chronic back pain, but do not dismiss it either. A small pain signal, good tolerability in that study, and a biologically plausible inflammatory pathway make probiotics a reasonable adjunct to discuss for selected people, especially when combined with movement therapy, weight management, sleep improvement, and an anti-inflammatory diet. Now give the audience a plan. Step 1. Identify the back pain pattern. Is it acute after lifting? Is there leg weakness, numbness, fever, weight loss, cancer history, trauma, or bowel and bladder change? If yes, do not experiment first. Seek medical evaluation. Probiotics are not emergency medicine. Step 2. Look for inflammatory clues. Morning stiffness lasting a long time, pain that wakes someone at night, pain associated with inflammatory bowel symptoms, obesity-related inflammation, or MRI-confirmed modic type 1 changes may justify a deeper discussion about gut-directed support. Step 3. Use probiotics as support, not substitution. Keep doing the fundamentals. Walk daily if tolerated, strengthen hips and trunk gradually, avoid bed rest, improve sleep, manage stress, and address excess weight if present. Then add gut support as one layer. Step 4. Feed the probiotics. Why take beneficial microbes and then starve them? Increase tolerable prebiotic fibers. Oats, beans, lentils, onions, garlic, asparagus, bananas, berries, and resistant starch from cooled potatoes or rice if appropriate. How do these help? Gut microbes ferment fiber into short-chain fatty acids, which can influence immune regulation and metabolic signaling. The Gut Disc Axis Review discusses microbial metabolites, including short-chain fatty acids, as part of the pathway linking gut ecology, immune activity, and spinal tissue biology. Step 5. Select and monitor. Try one evidence-informed product at a time. Track pain, stiffness, bowel symptoms, sleep, and function for 8 to 12 weeks. Use a simple 0 to 10 pain score and a function target. Can I walk longer? Can I sit with less pain? Can I sleep through the night? If nothing changes, stop and reassess. Do not collect supplements like trophies. Step 6. Respect safety. Probiotics are usually low risk for healthy adults, but they are not automatically safe for everyone. The NIH's National Center for Complementary and Integrative Health states that harmful effects are more likely in people with severe illness or compromised immune systems, and possible harms include infections or transfer of antibiotic resistance genes. So if someone is immunocompromised, critically ill, has a central venous catheter, severe intestinal disease, or is taking major immune-suppressing therapy, tell them clearly. Speak with a clinician before using live microbial supplements. Now return to the central question. Why can probiotics help back pain? Because they may reduce low-grade inflammatory pressure. How can they help? By supporting the intestinal barrier, changing microbial metabolite production, influencing cytokines, interacting with immune cells, and possibly reducing the inflammatory signals that sensitize spinal tissues and pain pathways. Why is this valuable? Because back pain is often treated from the outside inward. Brace, stretch, manipulate, inject, medicate. Probiotics invite an inside-out approach. Not instead of standard care, but alongside it. How should we speak about effectiveness? Say this: probiotics may be most effective when the back pain has an inflammatory or metabolic component, when gut health is poor, when diet is low in fiber, when antibiotic exposure has disturbed the microbiome, or when MRI findings such as modic changes suggest end plate inflammation. But they are less likely to help if the main cause is fracture, severe nerve compression, tumor, infection, major instability, or a purely mechanical overload that has not been corrected. So be precise, be calm, be clinical. Tell people to stop looking for one magic switch and start building a pain-lowering ecosystem. Let us close with one clear message. Back pain may begin in the spine, but it does not always stay there. It can involve the gut, immune system, metabolism, nervous system, sleep, mood, and movement. Probiotics may help because they work at one of the body's busiest control centers, the intestinal microbiome. They may calm inflammatory signaling, strengthen gut defense, alter metabolites, and reduce the biochemical background that keeps pain alive. So do this. Move your body, feed your microbes, choose probiotics intelligently, track your response, and involve a healthcare professional when pain is persistent, severe, or complicated. Do not treat probiotics as a miracle. Treat them as a smart supporting tool in a larger recovery plan. Thank you for being here with me. Stay well, Take care of your people, and I'll see you in our next topic. Same circle, same purpose, moving forward together.